Dan kullun TV, dan kullun TV, dan kullun TV, tashar al'umma.
Good morning to you all. I would like to use this opportunity to welcome you into this very important engagement we are going to witness today. As we are aware, the present government, under the able leadership of His Excellency, the Executive Governor of Zamfara State, and the partners supporting malaria activities in the state, especially GSCPSM, PMI for state, Breakthrough Action, doing with PMI, and also, I guess, Malaria Foundation has commenced activities for the 2023 ITM campaign. So I would like to welcome you to this very important engagement we are going to have today. That is the media engagement, to interact with the media, to inform the university, to inform them the activities so far, to carry out these activities. Because we believe the media has a very, very important role to play with regard to the issue of this next campaign. Because we want this information to reach every nook and corner of this Zamfara state, so that everybody should be aware. Because the net that is going to be distributed is for all the populace of Zamfara state, as you are going to hear from the Honorable Commissioner of Health. And you know, malaria is still very prevalent in Nigeria and also Zamfara state. So all these proactive measures are being taken so that to reduce the prevalence of malaria in Zamfara state, so that Zamfara state can contribute its own quota to the reduction of malaria burden to Zamfara, to Nigeria. Because as we are aware, it's still causing a lot of havoc, especially to children and also the pregnant mothers. So the activity that is going to be carried out in the next campaign, that is the distribution of ITN, is to ensure that people use this ITN so that we have a reduction of malaria burden, because it's one of the very important components for prevention of malaria. As we are aware, we are at the stage of eliminating malaria. You know, if you look at it, before we have National Malaria Control Program, State Malaria Control Program. Now we are saying where we call it elimination, because we have stages. We have control, we have elimination, then we also have the eradication. So eradication, when you don't have it in any geographical area. So now the elimination means that it's for us to have it in a specified geographical area, we don't have it, because there are some countries that have eliminated malaria. So it's possible to eliminate malaria, and also with this kind of strategies of using insecticide treatment is a very important component for this elimination. So it's a very important exercise. We are welcome to this very important program, and I urge us also to listen and also contribute our own quota for the success of this campaign. As we are aware, campaign is a very, it needs a lot of commitment from a lot of stakeholders. So please, media, they are very, very important component, and also very, very important stakeholders for us to achieve the success of this campaign. So please, we urge you to play your own role. We know you have been doing it, you have done it, and we know you are going to do it. So we are welcome to this very important engagement, and also to this media party. Assalamu alaikum.
My name is Bashir Adamukuso, Director Inspector Services, President Minister of Health, and Director overseeing the Office of Permanent Secretary, which we call Acting Permanent Secretary. I begin this speech of the Honorable Commissioner. I will start by recognizing directors from the ministry, our development partners, starting with PMI for State, Dr. Shilpa, you're welcome, and thank you for all you have been doing. The global supply chain, headed by Mr. Kingsley Mehola, you're welcome to Zamfara State. Thank you for everything. Breakthrough Action, we never forget you, Linda, Baho, and other parts of your team. We never forget you, and Zamfara State will never forget you in this campaign. PM Malaria, thank you for the activity in Zamfara State, and the technical advisor, who's soon going to be an international technical advisor, Ms. Mura Ismail. Gentlemen of the press who have the day, We thank you and welcome you to this media party. Today is your day. You have to carry out the mountain, but today is your day. This activity has begun since June up to July, and it will continue until January. It has been a long time that we have planned. So today, in my capacity as Permanent Secretary, or Director overseeing the Office of Permanent Secretary, I will read the speech of the General Commissioner, who is unavoidably absent for a national engagement, which is going to be for the benefit of people of Zamfara State, over 5 million. Now, I will read her speech directly. Bismillahirrahmanirrahim. The government of Zamfara State, in collaboration with the United States President Malaria Initiative and Against Malaria Foundation, will be distributing 3.2 million insecticide-treated nets in Zamfara State. Malaria is a disease transmitted to people through the bites of infected female Anopheles mosquito and can be life-threatening to children and pregnant women. Nigeria accounts for over 66 million malaria cases annually, and an estimated 30% of child and 11% of maternal deaths each year are due to malaria. Malaria remains the most common cause of absenteeism from schools, offices, farms, markets, and other areas of human endeavor. This resulting into lower productivity. It exerts a huge social and economic burden on our communities and the country, where billions of naira are lost to malaria annually in the form of treatment costs, prevention, and loss of man-hours. Gentlemen of the press, sleeping inside an insecticide-treated net is one of the best ways to prevent malaria, as it is a physical and chemical barrier against mosquitoes. Studies have shown that use of ITN reduces malaria prevalence incidence by 50% in sub-Saharan country, which is a region that accounts for more than 90% of global malaria cases. And according to 2021 Nigeria Malaria Indicator Survey, there was a reduction in malaria prevalence in Nigeria from 27% in 2015 to 22% in 2021. The current prevalence of malaria in Zamfara State is alarming. Gentlemen of the press, to reduce the burden of malaria in the state, His Excellency, the Executive Governor of Zamfara State, Dr. Dauda Lawal, through the State Minister of Health and in collaboration with National Malaria Elimination Program, the United States President Malaria Initiative, and Against Malaria Foundation, will be distributing 3.2 million insecticide-treated nets, and this will be conducted by reaching the entire household in Zamfara State, inshallah. Before this net will be distributed, every household will be registered. This is referred to as household mobilization, where persons wearing uniforms with malaria logo will visit the household from 1st to 7th of December 2023 to register and give out net cards that will entitle each household for a free net, 1 net per card. Distribution of the free net will commence on 24th of December 2023 to 2nd of January 2024. In the process, a representative of each household is expected to go to distributing point, written on their net cards, to collect free nets. Once collected, the new net should be spread out to air under a shade for 24 hours before hanging it in the sleeping area. It is expected that every member of the family should sleep inside the nets, well tucked over the sleeping area every night and all around the year, in order to prevent malaria. At this juncture, I would like to inform the gentlemen of the media that the ministry has directed all staff and facilities to be utilized for the success of this campaign under the leadership of the Honorable Commissioner. In conclusion, let's us win. Let's win the fight against malaria in Zamfara State by sleeping inside an insecticide-treated net every night. Thanks and assalamu alaikum. Dr. Aisha M. Anka, Honorable Commissioner of Zamfara State. Assalamu alaikum.
From the training, the distribution, implementation, even the post-distribution. And we'll also use this opportunity to encourage all to mobilize our people to make good use of this opportunity. Assalamu alaikum.
I stand on the existing protocol. Just want to appreciate the state for accepting this huge commitment from our donors, PMI and AMF. I bring greetings from the Global Health Supply Chain, who supported the implementation of the campaign in 2020 here, and is also here again to support this. Like the Honorable Commissioner has said, AMF, in collaboration with PMI, have procured the 3.2 million nets to be distributed across all the nook and cranny, all the residents of the of Zamfara State. And PSM is here providing technical support, and we are going to be here throughout the Christmas period, throughout the New Year period, to ensure that every single resident in Zamfara State is adequately protected, that they have access to the net. Not just having access to the net, we are also working with breakthrough action to make sure that they have access and also continue to sleep inside their net every night for maximum protection. Thank you very much.
I've enjoyed working with you for a long time. And this is the moment where we want to rely on your expertise and your support and your commitment towards ensuring that this campaign reaches every corner of the state. We've been working diligently with the Ministry of Health and all implementing partners seated here to ensure, just like my colleague Kingsley said, we don't just want them to collect these nets and go and hide under pew. No, that's not what we want. We don't want them to go and collect this net and go and use it and start guarding aleho or using it for fishing. We want them to collect these nets, let them dry them under the shade for 24 hours, then let them hang them and sleep inside them every night so that we give them complete protection against malaria. Please let us take this message forward. Tell your wards, tell everyone. We have packets for you around. You will see the timeline of the campaigns. From now, where we're doing this media roundtable, to the trainings, to the distribution. We will need you, especially during the time of the distribution. We know you've given the states and us slots to come and create more awareness in that, but in your own little way, please pass the message far and wide. Thank you once more. I will seek your indulgence. My colleague who has come to support us, Linda from Abuja, I'm sure she will want to add to what
I bring you greeting from my Deputy Director, Dr. Bola Tito Ayeniba. My colleague Baku has said most of the things that I would have loved to say. And just to reiterate on the issue on net use, we want to encourage our gentlemen of the press, our very important stakeholders when it comes to communication, to help encourage community members to keep on using the net and use it properly. We want to encourage them to sleep inside, because this net that has been procured, it's free, it's distributed free to the people of Zamfara State, but it was procured with a lot of money. And we don't want people to misuse what someone is already giving us for free. And that is why we want to encourage net use. When the presentation starts, you will find out that over the year, we as people of Zamfara State, we've not been doing well with net use culture. Yes, distribution of net have happened several times in the state, But even with the availability of the net, we are not doing well with sleeping inside. And that is why the malaria prevalence in Zamfara State is very, very alarming. So we want to use this forum to encourage our people, the community people in Zamfara State, to encourage them to imbibe positive net use culture. That is by sleeping inside their net every night throughout the year. Thank you very much.
The campaign with emphasis on the ongoing campaign in Zamfara State. Reorient journalists on malaria prevention control, especially emphasis on ITN campaign. Then we motivate the journalists to develop interest in the coverage and the reporting on the campaign, during and post-campaign activities. Then we want to also orient journalists on the importance of implementing ITN campaign in the context of emerging diseases. Get journalists to get joined in the national crusade for a malaria-free Nigeria. Then at the end of this gathering also, we expect the expected outcomes that our gentlemen of the press will need with improved knowledge on malaria prevention control strategy, especially on ITN campaign. Then that are the better informed about ITN campaign in Nigeria with emphasis on the Zamfara State campaign. Then we also want, at the end of this gathering, also to equip our gentlemen of the press with improved knowledge and skills, publications, and broadcasting campaign stories in form of documentaries, pictures, articles, human angle stories, etc. in the print and electronic media. Last but not the least, we're interested and commitment using the media to support the national goals on malaria-free Nigeria. Thank you.
That tends to place huge number of nets across the entire population at the same time. ITN mass distribution is done every 3 to 4 years, as recommended by WHO. That in every 3 years, after 3 years, the distributed net begin to lose its potency, especially the insecticidal potency is lost, and thereby will not be able to provide the required protection for the users. So the recommendation is that every 3 to 4 years that the net is replaced to guarantee maximum protection. ITN distribution is expected to achieve universal coverage. When we say universal coverage, we mean every single resident in a particular geographical area should have at least one net to every 2 persons. The first round of mass campaign, like I said earlier, was done between 2009 and 2013, while the second round was done, started in December 2013 in Sokoto State. Over 200 million nets have so far been distributed across the country. With the prevalence of malaria in Zamfara State being 37%, and with almost half of the children under the age of 5 having fever in Zamfara State, according to 2021 National Malaria Indicator Survey. ITN effectiveness for malaria control, and when properly implemented, will contribute remarkably to the overall reduction of malaria prevalence in the country. They include sleeping inside the net. It will protect you from mosquitoes bites that spread malaria, and yellow fever. It is very important to note that the mosquitoes that transmit malaria do not only transmit malaria, but also transmit yellow fever, as well as other diseases. And then sleeping inside inside mosquito nets will not only protect you from malaria, but will also protect you from other diseases that are transmitted through these insects. ITN also kills mosquitoes. It does not only protect you, it kills the mosquitoes when they come in contact with the insecticide on the net. And it also has the ability to repel the mosquitoes from the houses. It is easier and cheaper to hang and sleep inside the net than to treat malaria. We all know the economy of the country now. So it is better because it says that prevention is better than cure. So it is cheaper for us to sleep inside our net than to treat malaria. You gain health and save money when you hang and sleep inside your net every night. Looking at ITN campaign in the context of emerging and reimagined diseases, the COVID-19 pandemic threatened the implementation of some health interventions and similar emerging or reimagined diseases of public health importance, which have the potential to overburden the health system in the country. We are all aware of this. This can lead to the possibility of losing gains achieved in the fight against malaria if activities are not continued with adaptation where necessary. The WHO recommendation is for essential services to continue and innovative solutions found around the restrictions and limitations related with such emerging and reimagined diseases. Looking at ITN campaign processes. What is the ITN campaign processes? The first is macro planning. We have macro planning, we have micro planning, we have implementation, and we have post-campaign activities. Macro planning refers to the period when partners come together to decide on whether the state is due for campaign, which partner is ready to support the state to procure the net and also to provide operational costs. All those meetings that decide and confirm the procurement of the net and all that is referred to as macro planning. While micro planning refers to the all planning at the state level, coming from the grassroots, which is all the planning from bottom-top approach, which identifies all the material resources, human resources that would dovetail into the actual operational budget, is called microplan. It's a need assessment to be sure that we are not over-quantifying or under-quantifying those resources required to get the net to the final users. All these are known as microplanning. For implementation, of course, we are in implementation. Implementation of campaign begins with training, and it is an opportunity to inform us that trainings have been ongoing in the state for over 2 weeks now. And after training, we have what we call community mobilization. The community must own this process. Community must participate. If we must make gain in this process, community must participate. We also have transportation of net. As we speak, over 3.2 million net are currently here at the state warehouse. And this net will be moved from the state warehouse to the various LGA stores. And from the LGA stores, it will be going to designated distribution points where households are expected to come and pick their net. And then we have household mobilization, just like the Honorable Commissioner has said earlier in her speech. Household mobilization is a period when trained mobilizers within communities go from house to house to mobilize the houses, register the houses, and issue the net card, which they will use to redeem their net during distribution. After that, distribution will commence at the designated distribution point. At this period, it will last for 10 days between 24th of December to 2nd of January. This is when households, why we have this number of days, is to enable every single household that have their net card to come out and be able to access their nets. And then we have in-process monitoring and also end-process monitoring. We are going to be having over 12,000 personnel across the 14 AGAs monitoring this exercise at different levels. And also at the end of it, we are going to be having what we call CMTs, Campaign Monitoring Team, going back to those communities to assess our achievement and challenges. We want to find out if there were communities that were underserved. We want to find out if there were households that did not go to redeem their net. We want to find out if there are households that are not able to hang and begin to sleep inside their net. This will also inform the post-campaign activities. It will inform the communities that require support for maybe hanging and utilization of their net. And then we have data management there. The next is post-implementation activities. Post-implementation activities, like I said earlier, relies on the output of the end process assessment to know which communities require help and which LGAs require support to ensure improved hang-up and utilization of their net. We also have reconciliation and reverse logistics. Good to say that at the end of the campaign, every single net remaining at the distribution point is expected to be reversed back to the LGA store, from where the state will replan for the use of those nets. There are several channels through which this net can go back to the households, maybe through ANC services, through school-based distribution, or through community-based distribution. We also have post-campaign SBC, social behavioral change communication, just to ensure that people not only get the net or have access to the net, but that people continue to sleep inside their net every night for maximum protection. We have commodity management audit. The donors who have supplied this net want to come back and be sure that this net ended up at the households and not in the market. At the households, not in the market. So they'll be coming back to do what we call commodity management audit to find out if this net actually got to the households we said they have gotten to, or the net have found their ways across the borders of the state. We have net retention and use survey, which is channeled specially for those areas that have challenge of hanging and use. It is part of the post-campaign SBC, when we try to support the communities and the LGAs for hang-up and utilization. Next. This is LGA ITN campaign personnel coordination structure. At the local government level, we have the LGA supervisory team. The LGA supervisory team is actually autonomous at their various LGAs. The Director of Primary Healthcare is the leader of that, and then we have others that will also be supporting. At state level, we have the partners, NMEP, implementing partners, and the CITA, the Campaign Technical Assistant Team, providing support to the state. And at state level, we have the Director of Public Health, we have the State Program Manager, we have the State Logistician, and the State Health Educator, as well as a representative from the from the State Primary Health Care that is supporting the technical arm of the campaign implementation structure at the state level. However, the Honorable Commissioner also is the chairman of the ICCN, ITN Campaign Coordination Network. This is the committee that also supports the different work streams, the technical, the logistics, and the demand creation work stream to ensure that the high-level implementation is done without hitches. I was talking about the AGA level. Below the AGA team, we have the ward supervisors, and then we have the grassroots implementers reporting to the AGA team. Next. What are some of the lessons we have learned over time as we implement campaign? We have learned that early engagement improves ownership and effective partnership. Like we can see in the state, we started engagement of the state over a year ago. We've been planning and planning and planning, and that has shown the level of commitment and the level of ownership the state has shown in this campaign. It is highly commendable because the state is on the driver's seat, I must tell you, and I know that no stone will be left unturned. We've also learned that non-adherence to recruitment criteria puts the campaign in jeopardy. We have recruitment criteria for different kind of personnel. When this criteria is not followed, definitely the campaign is put in jeopardy, and the goal of the campaign will not be achieved by the end of the day. Effective monitoring also improved coverage. We've had campaigns in other states where stakeholders, even implementers at the lower level, don't go out to monitor this exercise. At the end of the day, you see a lot of complaints coming out from communities and households that the household mobilizer did not come to their houses, they were not registered, they were not given the opportunity to access the net. So this is another time to encourage us, including the media, to do their work and ensure that we go around and monitor this exercise and ensure that every single household in the state is reached with this net.
Everybody in the country is at risk of this dreadful disease. Is it preventable? Malaria report from WHO showed that we now have over 66 million cases of malaria happening in Nigeria annually. It is that bad. In fact, in the African region, 2 out of every 4 persons with malaria comes from Nigeria, in the West African region. Globally, because our prevalence now is 22, so even the mortality burden is also very high. So globally, when every 5 persons die from malaria, 2 comes from Nigeria. In fact, after every hour, 9 persons die from malaria coming from Nigeria. It is that bad. And we all know that this disease is caused by an infected female Anopheles mosquito. When this infected mosquito gives you a bite, it gets to transmit that parasite into your bloodstream. The national average from last year's report that was disseminated showed that the country is currently at 22%, which is an improvement from where we have been. The state's prevalence is currently at 37, not too good. Have there been progress made over the years? Yes. Can we improve? Yes. We are saying this so that we can all put our hands together, even as media persons, to support that fight against malaria. It is the commonest cause for absenteeism from work, from school, from offices, because when you are sick, you are not able to carry out your activities of daily living, and that will also affect the productivity. Net use is also a big issue, especially for us in the state. In fact, it is on the decline, and this is where we need the effort of you, our critical stakeholders, our media, to help us. The use of net is not speaking too good for the state, despite the effort of the state government that has also been working around the clock, and also the partners supporting the process of dropping malaria. You can see that the net use is currently at 40%. We expect from you to support us in achieving this output. What we want for this campaign in 2023 for Zamfara State is to have everybody become aware of this net campaign. Everybody to be aware, every household to receive at least a net. We want the community members to also note the benefit of sleeping inside the net. And that use that my colleague mentioned, airing the net under a shade for 24 hours, sleeping inside it consistently. We want everybody in the state to be aware of this. In fact, we want everybody to become net advocates. There was a state where we went for campaign, and the stakeholder told us that nobody in his household have had malaria for the past 21 years. 21 years, we all opened our mouth. He told us that he has a culture in his household that even if you are coming as a guest, even in his guest room, there is a net there that you will sleep on. Even when he travels, he goes with his net. Everybody in his house sleeps inside the net, so he does not treat malaria for anybody in his house for the past 21 years. So it means that if you sleep inside the net, you don't get bitten by the mosquitoes that spread this parasite, no mosquito bites, no malaria. It is that simple. My colleague will quickly talk to you, the media persons, on why you are crucial and why the support we require from you is crucial.
Thank you, Mr. Farouk. As my colleagues have already mentioned, the burden of malaria in our state our country, this tells us to see there is need to work harder and do more and more to see this culture has been down. As a media practitioner, as a personal, why you are very important in this campaign. Malaria, though, is a leading public health problem, gets under-reported in the media. All these issues presented, most of our reports is missing these reports because we are not aware of such reports. Why? What can we do to get reports into our media platforms? The media do offer great service and provide direct opportunity to save lives and help people to be better. We know how the media is powerful. In this country, we know how we use media to influence somebody or to get what we want through media. Why can't you use that approach to improve the usage of insecticide of our state? Because we change people's behavior. Media is the best suited to support the essential and confirm, which is the sustenance of the net use culture. We know our people, they have culture, they know, but acting and working with the knowledge they know is a very challenge. How we can become as a influencer people to become a role model to talk to the popular society can change the situation. Media, as an advocate of the voiceless, we media we are presenting the voice of the voiceless, isn't it? Why can't you talk with the language of the media to our society so that they can copy from what we are? Why can't you continue to inform them important sleeping inside insecticide every night? Yeah. What do we expect from you for this campaign? Keeping malaria issue in the front of burner of the health news. We want to take malaria news is very important, especially during this campaign. We want you to contribute your own quota as a corporate responsibilities within this campaign to have so many news from papers, print, television and radio. We want to have news everywhere about what? This campaign. Provide adequate media publicity before, during, and after the campaign. Now we are on free campaign activities. If you are listening to radio station, we are starting having the spot for our free campaign. We want you as a media practitioner to come up with a program of activities to inform people for this stage, up to the during and after the campaign. We want you to come up with a publicity program to sensitize our audience. Subsidize media placement for ITN promotion, and also continue to promote use of ATN after campaign as part of the corporate social responsibility. As we know, people used to get the net, but usage is zero. Why always, up to now we are at 37%, but the uptake of the net is almost every household has the net, but the usage is all still 37. Why? Because of after the distribution of net, people are keep the net under the pillow. Some are taking to the farm. Some are saying some complaint. If I sleep under net, something happens. What media can continue after the distribution to maintain that campaign, to maintain the use of net for our society, and also follow the process throughout the through to the interest and educative human interest stories. We want to hear from you people to create some people stories, angles about the malaria or about the usage of ITM in our society. We are ready, the ministry is ready to help you with the knowledge, with the content you want and guide. Then our key audience for this campaign, Because if you know your audience, that's why now you know we are equipped, we are hoping by this presentation, now you are equipped with the knowledge about
24 hours, if this is 1 o'clock, you put it under the shade, same time. This man is helping his household to hang his net. The nets have anchor at every corner, and loops can be used to anchor those anchorage and attach to any place in the house. You can see how these women are enjoying their sleep. Can we see? The mother, the 2 kids. I want us to also look at how the edges of the net, these are there enjoying their sleeps. The father will also be happy because